and Isebania borders are at risk of contracting the coronavirus. Over 3,000 drivers who have been camping there are waiting to be screened and tested by authorities along the Uganda, Kenya and Tanzania borders. Setolale has just landed back from the various border points with a multi-agency team that has been inspecting these areas and reports that they are porous.
A 10-kilometer stretch of tracks waiting to cross into Uganda, probably a common sight at the Malaba 1 border point in Busia. The trailers snaking for kilometers here would normally be experienced when customs officials are overwhelmed. But what you see is as a result of the COVID-19 screening of drivers at the stations. But this perhaps is counterproductive, as other drivers mingle freely with residents as they wait to be cleared by officials. There are an estimated 200 trucks with 3,000 drivers from either side of the border stalled in Malaba town for at least a week. Truck drivers ferrying goods into Uganda have to undergo a 14-day quarantine at the entry point in Malaba, but the quarantine here is not in the strict sense of the word, as they still mingle with the locals.
Tunaona kwa gari, tunaona kwa madriver hana chakula, mahali ya kuoga hakuna. Inakuwa wizi inakuwa mingi kwa barabara.
Kupima dereva moja it takes like 3 hours or 2 hours kama ni less. So hiyo unapata kwa siku ni dereva kama 10 wanaweza pimwa na it takes 2 days kupata results. So ina delay upande wa clearance. That's why unaona foleni imeenda mpaka mbali sana, over 5 kilometers.
They come and spend most of the time here and mingle with the people, and it's the greatest fear that we have to manage it. First, we have to have a trailer park where they can be stationed before they cross.
In addition, while Kenyan custom health officials are only checking temperatures, the Uganda counterparts are conducting comprehensive process, including testing samples before clearing truck drivers.
We have, as part of our expanded targeted testing, planning to do tests here. We will be able to collect samples and be able to process them elsewhere in the beginning and report the results. But we are also working on programs to try to actually do tests on the spot.
The situation is mirrored at the Busia border point. According to the county leadership, health workers at the customs have inadequate masks, sanitizers and staff training. Busia County has no single operational ICU.
Then the protection of the PPEs for our health workers, they are scared to work without those ones. I think that's a very, very urgent thing that should be addressed.
The challenges experienced at the Malaba and Busia borders are also being experienced at the Kenya-Tanzania Isebania border.
In terms of human resources, in terms of equipment and even utility vehicle that can shuttle around with the suspected cases to designated quarantine centers. So those ones are still lacking.
Look at gaps that are there that we can be able to address. Fourth, to recommend on what actions to be taken both right here and what we are required to go and do in Nairobi. That is why we were in Taita Taveta, Kwale and Kajiado yesterday, Lunga, Namanga and Taveta.
It is feared that carriers of the deadly virus are penetrating into either side of the borders. Now, officials are warning that this could be a time bomb and want the national and county governments to take action immediately. Seth Olale, NTV at the Isebania